My dear students, Dr. Ashfaq over here, and as you are well aware, I have authored books for Neet PG, Neet DM, Neet MCH, as well as some of the books for USMLE examinations, MRCP examinations, and my lectures would be intended to get you right on the top there for your next examinations, DM examinations, MCH examinations, MRCS, MRCP, USMLE examinations. I hope my videos will benefit you a lot. I will be presenting my things in a very easy, simple and palatable form for you. Wish you good luck for your exams. Thanks a lot. So today we will be coming up with an important topic, and the topic is pharyngeal apparatus. As far as the pharyngeal apparatus is concerned, it tends to be important from multiple aspects. From the aspect of anatomy, especially embryology, from the aspect of neonatology, from the aspect of pediatrics, ENT, head and neck surgery. So we will be covering all the basic embryological and the clinical aspects related to the development of the pharyngeal apparatus. As far as pharyngeal apparatus is concerned, you have to remember that these three layers. There are three layers: the ectoderm, the endoderm, and the mesoderm. And all the three layers contribute to the development of the pharyngeal apparatus. And to be very specific, the pharyngeal apparatus is composed of three important parts, as you can well see on the board. The first part is the arches, and the second part is the clefts, and the third part is the pouches. As far as the arches are concerned, they represent the mesodermal component of the pharyngeal apparatus. And as far as the clefts are concerned, they represent the ectodermal component. And as far as the pouches are concerned, they represent the endodermal component of the three germ layers. Now, what happens during a certain stage in the embryogenesis, especially during the 4th week of development, the pharyngeal apparatus tends to develop. Now, what happens in the first instance, as you can see on the diagram over here, this is the middle layer and this is the mesodermal component in the middle. That's why we call it mesodermal. And towards the outer surface, considering the left part to be the outer surface, so this is the ectoderm and this is the endodermal part. And as you can see, we have written the name, the ectodermal clefts. It is because it lies on the outside and there is invagination or indipping in the form of clefts. So this is the ectodermal cleft, and this middle ridge is the mesodermal ridge, or the ridge where the future pharyngeal arches have to develop. And these are the pouches, the pharyngeal pouches, which represent the endodermal component of the pharyngeal arches. Now, what happens? This all happens in the region of the future neck. During embryogenesis, the relative disposition of the organs and the organ systems is far different from what it is seen in case of adults. Now, coming back to the pharyngeal arches, you have to remember that the pharyngeal arches are counted over here. If you have a look at the pharyngeal arches, you can see there is nothing wrong in the numbering. We have written 1, 2, 3, 4, and 6, and 5 is absent. The 5th arch in case of humans does not develop, and we have these 1, 2, 3, 4, and 6 pharyngeal arches which are designated over here. Basically 5 in number, but the 5th arch does not develop in humans and it is missing. That is why 1, 2, 3, 4, 6. Now, in addition to this, first of all, taking the pharyngeal arches without touching the ectodermal and the endodermal component, we focus our strategy on the pharyngeal arches. So pharyngeal arches, as I was mentioning you, are 5 in number. Now, each pharyngeal arch has got 4 components, and the components are: number 1 is the cartilaginous or the skeletal component. The second is the nervous component. The third is the arterial component, and the fourth is the muscular component. What I say in a nutshell is that from the pharyngeal arch, we have got muscles developing, we have got the nerves supplying these muscles, we have got the artery supplying this arch, and we have got a skeletal or a costal element in relation to this arch. Now, taking up sequentially first arch, it is very important to remember that the cartilage of the first arch is given the name as Meckel's cartilage, and this cartilage is very important. Sometimes questions are asked as far as eponyms are concerned. Meckel's Richards, and the cartilage of the first arch is given the name as Meckel's cartilage. And from this cartilage what develops are, number 1 is malleus and number 2 is incus. Basically malleus, incus and stapes are 3 auditory ossicles or ear ossicles, and malleus and incus are developed from the cartilage of the first pharyngeal arch. In addition to this, the anterior ligament of malleus and the sphenomandibular ligament are also derivatives of the first pharyngeal arch. It is a question very frequently asked, the components or the derivatives of the arches. So you have to remember in a nutshell that malleus, incus, the anterior ligament of malleus and the sphenomandibular ligament are the derivatives of the first arch, which is the cartilage of the first arch, which is given the name as Meckel's cartilage. Now, going to the second arch cartilage, that is given the name as Richards cartilage, and from the Richards cartilage develops what is left from the first arch. I mentioned to you malleus, incus and stapes. Stapes is the auditory ossicle which is developed from the second arch, the cartilage of the second arch. So stapes develops from the second arch. In addition to this, we have got the styloid process, which is an elongated process present at the base of the skull, very important component, and from here multiple structures are derived, but the styloid process is also derived from the cartilage of the second arch. The cartilage of the second arch, as I mentioned, is given the name as Richards cartilage. And the third thing which develops is the superior cornu of the hyoid bone. And in addition to that, there's one ligament, the stylohyoid ligament, which is developed from the cartilage of the second arch, in addition to the superior surface of the hyoid bone. So if you just have a look, it is all S. I mean to say that the word S is very important as far as the second arch is concerned. The cartilage of the second arch leads to development of stapes, styloid process, stylohyoid ligament, the superior cornu of the hyoid bone, and the superior surface of the hyoid bone. So you remember the word S, that will help you in memorizing the derivatives of the cartilage of the second arch. Now, common sense, we come to the third arch and we can just derive that we are left over here. We describe the superior cornu of the hyoid bone and the superior surface. So we have the lesser cornu of the hyoid bone and the inferior surface. So simply they develop from the third arch. As simple as that. So this is something about the main derivatives of the first, second arch and the third arch. Now, as I mentioned you at the onset, these arches have got 4 components. So the skeletal or the cartilaginous element we discussed over here. Now, second thing is, what are the important muscles which are derived from the first pharyngeal arch? You have to remember that the first pharyngeal arch, before going to the muscles, I will just let you know what are the nerves supplying the arches. So we have got the first arch. The nerve of the first arch is given the name as mandibular nerve. It is also given the name as mandibular arch because the mandibular nerve supplies the first arch. Now, the nerve of the second arch is the 7th cranial nerve, the facial nerve. So mandibular nerve is the nerve of the first arch, the facial nerve is the nerve of the second arch, and third thing is the glossopharyngeal nerve, which is the 9th cranial nerve. It represents the nerve of the third arch. Then we have got superior laryngeal nerve and the recurrent laryngeal nerve, which respectively supply the 4th and the 6th arch. Now that means the mandibular, facial, glossopharyngeal, superior laryngeal and the recurrent laryngeal nerve are the nerves of the arches 1, 2, 3, 4 and 6. That's important. Now, because the mandibular nerve supplies the first arch and mandible is a bone which is concerned with mastication, the muscles concerned with mastication are derived from the first arch. So you know masseter, temporalis, medial pterygoid, lateral pterygoid. These are the muscles concerned with mastication attached invariably to mandible, and they are derived from the first arch. In addition to that, you have got two tensor muscles. One is the tensor tympani and second is the tensor palati. They are also derived from the first arch. In addition to one belly of an important muscle, anterior belly of digastric. Here I do not mention the posterior belly of the digastric. So you have these muscles which are derived from the first arch. Now, second thing is that what is derived from the second arch? As anterior belly of digastric is derived from the first arch, the posterior belly of digastric is derived from the second arch. In addition, most of the muscles attach to the face. Muscles of the face is an important topic which will be dealt separately, and there are multiple muscles on the face because you have got so many emotions, laughter, excitement, depression, grief, sorrow, and this is directly reflected by the muscles of the face. And these muscles of the face is an important chapter which we'll be discussing in head and neck. But over here you have to remember that muscles of the face are derived from the second arch. And you know the muscles, zygomaticus major, zygomaticus minor, procerus, we have got the orbicularis oculi, orbicularis oris. These are muscles of the face which we'll be dealing separately. But here you have to remember that muscles of the face and the posterior belly of digastric are derived from the second arch. The third arch, which is supplied by the glossopharyngeal nerve, gives rise to one muscle, and that is the stylopharyngeus muscle. Very important, sometimes asked as a one-liner. And then we have got the fourth and the sixth arch. The cartilages and muscles of the pharynx and larynx as a whole are derived from the fourth and the sixth arch. These are very important points, and these are invariably asked in your examinations, and you have to remember them precisely. What is derived from what arch, along with the nerve supply. Now, as I told you, we are done with the muscular component, we are done with the nervous component, we are done with the skeletal or the cartilage element. Then these are the vessels which supply, which are specific to each arch. And you have to remember that the first arch artery is represented by the maxillary artery, and the second arch is represented by the stapedial artery, and the third arch is represented by common carotid and the internal carotid. The fourth arch artery is represented by the right subclavian artery, and the sixth arch artery is represented by the pulmonary artery. Very important, you have to remember which nerve supplies which arch, which artery, which vessel from the primitive aorta or the primitive angiogenetic model gives supply to which arch. So these are some of the important components which you have to remember as far as the pharyngeal arches are concerned. Now, from the pharyngeal apparatus, there is something which we have, the clefts. As I told you over here, this is the cleft, the first ectodermal cleft, and this invaginates inside. That is why this is given the name as cleft. And these ectodermal clefts lie on the outside towards the exterior. Now, the proximal clefts develop more than the caudal clefts. That means the first and the second clefts are more well developed in case of humans. So what develops from the first ectodermal cleft is the epithelial lining of the external auditory meatus. We are not going into the anatomy of the ear, the external ear, internal ear, the middle ear. No, the external auditory meatus is what is derived. The epithelial lining of the external auditory meatus is derived from the first ectodermal cleft. And in addition to that, we have got pinna. And the pinna is developed in relation to the first ectodermal cleft and the first and the second pharyngeal arches. So the pinna develops from certain tubercles, certain hillocks in relation to the first ectodermal cleft. Now, as far as the other clefts are concerned, what happens? The pharyngeal arches and the proximal clefts overgrow. Over here, they overgrow the subsequent clefts, and in here we have got a sort of a sinus which develops, and this we give the name as cervical sinus. So over here, in relation to the clefts over here, we have the development of a sinus, and what has to happen with the sinus is that this sinus has to get obliterated at a later stage of life. So nothing of this sort should remain once a child is born. But under certain conditions of abnormal embryogenesis, this sinus does not obliterate. This cervical sinus does not obliterate, and as a result of which there is a cavity, a cystic cavity, which develops in relation to the future neck, and those we give the name as branchial cysts. So what is a branchial cyst? A branchial cyst is due to non-obliteration of the cervical sinus, and this develops in relation to the ectodermal clefts. So in case this branchial cyst, it can lead to the development of the branchial fistula, and it can lead to the development of the branchial sinus as well. That would be dealt with in surgery. Over here you have to remember this important component about the branchial cyst. And this branchial cyst can be in isolation, it can be unilateral or rarely bilateral, and it can occur in relation to BOR, what we call as bronchio-otorenal syndrome, a clinical entity where we can have these branchial cysts. In addition to that, we have BOF, branchio-oculofacial syndrome. So branchial cyst can be seen as a component which exists independently or as a result of BOR syndrome or as a result of BOF syndrome. So that thing is for super specialty and higher PG level. You remember branchial cyst and genesis as far as your MBBS course is concerned. So we have dealt with the clefts. Now we have got the pouches, and what do the pouches represent? They represent the endodermal component of the pharyngeal apparatus. And what do we mean by a pouch? Pouch is a bag, a circulation, as you can over here see, towards the interior and in the form of circulations. And these, unlike 1, 2, 3, 4, 6, they are correctly numbered 1, 2, 3, 4, 5. So pharyngeal pouches are again 5 in number, and they are numbered without having the differences that over here the 5th is absent. Here we have the 5 present. Now what are the derivatives of the pharyngeal pouches? You have to remember that from the first pouch, we have the tongue developing. In relation to the first pouch, we have the tongue developing, and in relation to the second pouch, we have an important lymphatic component, the tonsil. I mean to say the palatine tonsil. There are multiple tonsils in the body. I'm not going to cerebellar tonsils and all those things, but the palatine tonsils are developed in relation to the second pouch. In relation to a part which we call as tubotympanic recess, we will deal it with in head and neck. Or here, you just remember that the derivative of the second pharyngeal pouch is the tonsil as well as the tubotympanic recess. Now, very important thing is third pouch. The third pouch leads to development of 2 glands. In fact, we have got this very important gland in the neck, especially in case of children, well developed, which later on regresses in adulthood, and we give that the name as thymus gland. The thymus gland develops in relation to the third pharyngeal pouch. One important thing that we have the parathyroids. There are 4 parathyroid glands, 2 superior, 2 inferior, present in the body. And from the third pouch, it is the inferior parathyroids which develop. Very important, a question frequently asked. From the third pouch, it is the thymus and the inferior parathyroids. And from the 4th pouch, it is the superior parathyroid. Reverse. Normally, we could have expected the superior to be derived from the third pouch and the inferior to be derived from 4th. It is not like that. Because of the thymic descent, the thymus drags the parathyroids down, and that is why the inferior parathyroid develops from the third pouch. The 4th leads to development of superior parathyroid, which remains in its normal position. Now, as far as the 5th pouch is concerned, there's a lot of controversy about what develops from the 4th and 5th as far as the ultimobranchial body is concerned. Ultimobranchial body is a component well developed in case of lower mammals, especially fishes, not so well developed in humans. And humans, it is restricted to a component which we give the name as ultimobranchial body, and just leading to the formation of the parafollicular cells of thyroid. As far as the parafollicular cells of thyroid is concerned, they are very important because parafollicular cells of thyroid are concerned physiologically with secretion of calcitonin, and that regulates the calcium metabolism over here. So you have to remember 1, 2, 3, 4, 5, and the thymus and the inferior parathyroids develop from this thing, and the superior parathyroids develop. Some authors believe that the ultimobranchial bodies are derived from the fourth pouch, and some believe that the ultimobranchial bodies are derived from the fifth. I would accept both because it is no consensus has been there whether exactly it is the fifth or no. We have studied these arches, we have studied these clefts, we have studied these pouches. What is clinically relevant? Why do we study them? Now, as far as the pharyngeal pouches are concerned, you are well aware of the fact that taking these two pouches into consideration, we just mentioned that this third and the fourth pouch leads to development of the thymus and the parathyroids in entity, in totality. Okay. Now imagine that at some point of time a child is born with maldevelopment or hypoplasia of the third and fourth pharyngeal pouches. What can you expect? Now this is the gland which is the thymus, and thymus is very important as far as the processing of T lymphocytes is concerned, and parathyroid glands, both the superior and inferior, they are concerned with the regulation of the calcium metabolism. Now, in case the parathyroids are not developed, we can have low blood or serum calcium levels, which we give the name as hypocalcemia, which we will study more in detail in medicine, in emergency medicine and physiology. But over here, you know that the hypoplasia of parathyroid glands can cause hypocalcemia, and that can cause abnormal movements. So a child presenting with abnormal movements and thymus, hypoplasia of thymus, concerned with the processing T lymphocytes. If the T lymphocytes are not processed well, what can happen? T lymphocytes will not be able to function normally, and the child, the neonat, will be having immunodeficiency, and he or she can present with repeated infections. Check my word, repeated infections. A child will be coming with repeated infections, abnormal movements, and if case a child has got maldevelopment of thymus, maldevelopment of parathyroids, he or she can come with repeated infections and hypocalcemia, and this is the clinical entity we give the name as DiGeorge syndrome or Cash-22 syndrome. I am not going to the genetic basis, the chromosomal problems associated with this syndrome, and because this DiGeorge syndrome, these pharyngeal pouches 3-4 develop in relation to pharyngeal arches. There can be some other abnormalities of the pharyngeal arches as well, like the child presenting with the same child presenting with cleft lip, cleft palate, and a lot of problems with cardiovascular system, like the tetralogy of Fallot, like VST or other defects, and in addition to that, micrognathia and many other features. So this is the clinical implication of just reading these things. I hope that you have understood these things well, and in addition, I think that from the pharyngeal arches, you have to remember, if something goes wrong with the development of the pharyngeal pouches, there can be something wrong with the development of pharyngeal arches as well. Now imagine that the first and the second arches do not develop well. So what can be the problems? Because these arches lead to development of the auditory ossicles, they lead to the development of the face, they lead to the development of the bones of the face. So they lead to the development of the mandible, they lead to the development of the maxilla. So we can be having features of maxillary hypoplasia, mandibular hypoplasia, cleft lip, cleft palate, maldevelopment of ossicles leading to auditory problems, and that we give the name as arch syndromes. And two arch syndromes are there, you have to remember. One is the Perry-Robinson syndrome, and second is the Treacher-Collins syndrome. Perry-Robinson syndrome mostly concerned with the mandibular hypoplasia, micrognathia, retrognathia. I mean to say that the chin is small, not a well-developed mandible. Retrognathia, the mandible is pushed backward, causing a gross cosmetic deformity. In addition to glossoptosis, the tongue falling backwards, and that can cause severe problems with respiration. And in addition to that, microcephaly as well. Cleft lip and cleft palate can occur there as well. And especially in Treacher-Collins syndrome, we can have mandibular hypoplasia, maxillary hypoplasia, we can have cleft lip, cleft palate, which are common, and there can be disturbances in the intercanthal distance as well. and so many other defects. But over here, this is important to remember that there can be R syndromes, there can be DeGorge syndrome as a result of maldevelopment of pharyngeal pouches, and in case you just tend to remember the concept over here, and you have to try hard to remember the concept over here. You have to try hard to remember the specific things derived from the pouches, the specific things derived from the arches, and that will tremendously help you in appearing in your NEET PG examinations. Whatsoever type of questions you are faced with, this concept is very important. I wish you good luck in your academic ventures and hope that this class of mine would have just simplified your imagination and views about pharyngeal apparatus. Thanks a lot.